Soaring healthcare costs force many Coloradans to suffer financially if they choose to get the care they need.
Colorado's new Governor Jared Polis says he has a plan to help lower healthcare costs for everyone. He's looking to create a reinsurance program as one solution.
Denver 7's Jennifer Kovaleski explains tonight how reinsurance works and goes 360 on the proposal.
Reinsurance is basically insurance for insurance companies. It's a way to stabilize the private insurance market, covering those patients who drive up costs to reduce premiums for everyone else. So you're probably wondering, how are we going to pay for this? I'll explain in a minute. But first, let's take a look at the different perspectives. Think of this like how you would pick an insurance plan. Governor Jared Polis is the one selling it. He says reinsurance is a way to do something right now about high healthcare costs. The Democrats are the advocates. Let's call this one the blue plan. They see reinsurance as the biggest piece of the puzzle to make a dent in premium costs. For our next option, the side of the GOP, we'll call it the red plan. Republicans have concerns over the high cost to fund it. Politics aside, there's also the perspective from health experts. Let's call this one the green plan. They've seen success in other states, and our expert believes a similar plan can work in Colorado. We'll start this 360 with the man selling the plan. When Governor Jared Polis signed this executive order, he quite simply created an office dedicated to saving all of us money on health care. That's what it's called.
We're giving it a simple name because it is important. The Office of Saving You Money on Health Care.
Polis doesn't hold back when it comes to the high cost of health care and the need to do something about it.
Whether people are independent or Republican or Democrat, they're all being ripped off on health care costs.
He's selling reinsurance as a way to lower premiums now. Polis is asking lawmakers to invest $1 million to start setting it up, with hopes of a rollout by next year.
This is the right low.
To bring down the high cost of insurance for people who buy their own policies in the exchange.
Democratic State Senator Carrie Donovan is the advocate and ran on the promise of making healthcare more affordable.
It's a promise that I'm going to stick to and keep fighting for.
Like Polis, she believes now is the time to act.
It has to be the year to get something done.
In her view, reinsurance is a way to deal with those really expensive patients, reducing the impact on everyone else.
That outlier expensive patient pulls everyone else's costs up.
She also believes it could put a huge dent in premiums for those hit hardest by rising insurance costs. People who pay out of pocket because they're self-employed or don't have insurance through an employer.
Reinsurance could lower the cost by 20 to 30% in some areas.
But where the politicians differ is in the details and the cost to the government. You know Republican Senator Jim Smallwood.
Reinsurance program for me is one step toward single payer.
Smallwood doesn't support the idea and worries about the impact of having the state in the game.
Obviously, having the government involved in a mechanism that kicks out health insurance companies in part of their role.
Let's get back to how this state-run program is going to get paid for. Well, that's not an easy answer. In one scenario, the Division of Insurance estimates a small plan would cost the state $70 million, while a large plan comes with a whopping $346 million price tag, which would have required nearly 2 million Coloradans, including large businesses and their employees, to pay the fees on insurance plans that would have lowered premiums for nearly 125,000 residents. The Colorado Chamber opposed the bill, saying putting the cost solely on the backs of employers and workers who do not even participate in the individual market is not the right solution. Our employers and workers would subsidize individuals who may not even be their own employees. Let's bring in healthcare expert Adam Fox with the Colorado Consumer Health Initiative.
There is a question about how we fund the reinsurance program and where that money is coming from.
Despite the clear funding question, he still views reinsurance as a game changer and says other states have seen success. According to the Urban Institute, Minnesota saw premiums fall by 15%. Alaska also saw year-to-year decreases.
The concept of reinsurance has been very beneficial in a few other states, and I think it could have a very positive impact for Colorado consumers.
Happy to take some questions.
Polis has hinted at figuring out a way to make a reinsurance plan work with a much lower price tag. But lawmakers are still hashing out a bill they plan to introduce in the House this legislative session.
We're going to have to do all sorts of things to address the high cost of care.
Jennifer Kovaleski, Denver 7.